Salah satu sektor yang diharapkan bisa mendukung pertumbuhan dan pemulihan ekonomi adalah sektor kesehatan, termasuk industri asuransi. AIA Financial Indonesia yang masih ikut mendukung acara CEO Forum meyakini negara yang sektor kesehatannya sehat, ekonominya bisa sehat dengan cepat. Berikut wawancara kami dengan Presiden Direktur AIA Indonesia, Sainthan Satyamoorthy, yang sudah kami rekam sebelumnya. Pandemi membuat masyarakat Indonesia sadar akan pentingnya proteksi kesehatan. Nah, bagaimana dukungan dari industri asuransi terhadap tantangan yang terjadi di sektor kesehatan, terutama dari jaminan kesehatan? Kami sudah bersama dengan Presiden Direktur AIA Financial, Sainthan Satyamoorthy. Pak Sainthan, thank you for being here today with us.
Thank you very much for the invitation and thank you for the fantastic event as always.
So the first question is about, as we all know that the pandemic hit us so hard in every sector, include the healthcare sector. In your point of view, in the insurance sector view, what is the future? How is the future of healthcare national sector?
It's an interesting question because if you look at the impact of the pandemic, take, for example, the Delta wave that we had. That was probably the worst. We saw the impact in hospitals, the number of people in the hospital, unfortunately, the number of people that lost their lives as well. When we look at our own data in AIA, we see that actually the mortality rate for every age went up. So it didn't matter whether people were young or old, it went up to 2 or 3 times what we would normally expect for mortality rates at those ages. So the impact was very, very significant, not just from the healthcare cost, but also the mortality risk and the death risk that we cover in the life insurance industry. The good thing as a company in the life insurance industry, our business is about risk management. So we were prepared financially, we have enough capital, we have enough reinsurance cover in place to weather those challenges. But if you look forward from that, this is because of the pandemic, this is because of COVID-19, and we have responded to it like we have responded to every other disease of its kind with vaccination.
Okay.
And as vaccinations rates went up around the world, as booster rates went up, we see the impact of COVID coming down. Even in our own portfolio, we see the difference in the death rate because of COVID and what we would normally expect coming down to a minimal level now. So while people are still getting sick, thankfully, with better health care and with vaccination, the impact is nowhere as great as it was before. So if you take communicable diseases like COVID aside, because we have a way to manage it with science, with technology, with vaccination, the real underlying problem we need to solve is around non-communicable diseases.
Does the pandemic somehow challenge the insurance sector even more? And what is the biggest challenge and problem over the past year?
As I mentioned, the pandemic has an immediate effect financially for us to manage the financials and the risks and the impact, and of course to make sure we take care of our customers. Many were sick, many lost loved ones. We had to make sure that claims were paid quickly, claims were paid to the families to help them manage financially with the loss of someone in their family. But again, it doesn't change the fact from the real underlying long-term problem we have in healthcare, which is around non-communicable diseases. If you look at data from the World Health Organization, globally, approximately 70% of premature deaths, and I think in Indonesia the number is about 73%, are because of poor diet, not enough exercise, smoking, too much alcohol, and now air pollution. So those 5 things, which actually are things we can control, we can manage, we can do something about, is responsible for 70% of premature deaths around the world. And that, of course, doesn't come with immediate death. It comes with people getting sick, people getting hospitalized, people needing treatment, which then becomes a burden on the state healthcare system, becomes a burden on BPJS. Of course, as an insurer that also does health insurance, we also have to pay out and we also support our customers who get sick. So the real long-term challenge is about how we help people change their behaviors, make those small changes in their life that helps improve their health. For example, we've had our AIA Vitality program running in Indonesia for the last few years. We've had it running across the group, across Asia for 10 years now. What the program does is make it easy for people to understand their health. You can do some online questionnaires, you can go to some of our test partners, find out what's the status of your health, then choose to make small improvements. Do a little bit of physical activity, go to the gym, join in an activity with other people. But the important thing that holds it together is when you do that, we reward you for it. So for example, by just starting a little bit of physical activity, going for a walk, taking 7,500 steps every day, you get points. And if you do that 5 times in a week, you get a voucher to spend and reward yourself because you've taken the effort to try and improve your health. And then we keep building on that to help people make those small, sustainable changes in the health. We all, when it's coming to the new year, on the 1st of January, we'll all make New Year's resolutions to go to the gym and become healthier. Yes. And then on the 2nd of January, we'll forget about it, unfortunately. So we understand that. We understand behavioral economics as well as healthcare. So it's about helping people make those choices, make them consistently, and make changes in the health. If we do that, together with improvements in the healthcare system, we'll actually be able to manage the costs and the impact of healthcare into the future.
But besides that, what is your contribute or your support to digital to transform healthcare national sector? Because as we through these years, we see that government is trying so hard to handle the pandemic as quick as possible. And one sector that support is digital. So how does the insurance sector support digitalization?
It's a very interesting question because healthcare actually is a human problem. There's a part that really requires people. You need to see a doctor. You need a doctor to take care of you. So we really look as an insurance company at 2 different areas. One is what we call the incidence rate. How often do people get sick? And then we look at the cost every time they get sick. Where we have used digital, for example, to avoid people getting sick, engaging people through our AIA Vitality app, helping them understand the health, helping them make those small changes, those better choices. Once in a while, choose a salad and not a steak or nasi goreng. I know it's not easy because the food tastes very good, but helping people make those small changes, nudging them, informing them about it, giving them information through digital. So we reduce the risk of them becoming sick, help them be healthier, which also means they contribute to the economy more, make a bigger difference to the country as well. And then when they do become sick, we help people make sure they get the right care. For example, we have a service we call personal case management. If you're sick and you go to hospital, of course you see the doctor diagnoses you, gives you the treatment that you should have. What we've seen and what we all know, doctors are humans. And humans can diagnose based on the knowledge that they have. So through our personal case management, we put you in touch with a panel of doctors, nurses, specialists from around the world, not just to get a second opinion, but they will discuss your case together with your doctor here in Indonesia. And it's worked extremely well. We've had about 1,500 customers or so gone through the service. 23% of them, almost more than 1 in every 5 of them, had a change in diagnosis. 70% of them, the treatment change. Those are very shocking numbers when you hear it. Some were small changes, some were very large changes. People avoided surgery, people avoided very serious treatments because it wasn't necessary based on wider knowledge available in the healthcare space. I have to be honest, when we launched this program, the biggest thing I was worried about is all the doctors in Indonesia and hospitals will call me and not be very happy. But I think we should be very, very happy and proud of the healthcare professionals in Indonesia. We have never had a single doctor say, I don't want to talk to our specialists. They're happy to listen, to speak to these specialists from around the world, get new information, understand what the latest research is, find the different treatment paths that actually can help their patients. And the benefit of that is the patient now gets help, but the doctor in Indonesia is learning something new, which they can then use to treat any other patient they see thereafter. So digital is very important in enabling all this process, but we have got to balance the digital with the people aspect as well.
Okay. Thank you so much, Pak Sainthan. It's a pleasure for us to have you today. Thank you, Pak.
Thank you very much.
Thank you.